It is January 12th, 2022, and today I'm here with my friend and colleague, John Brownstein. I'm going to let John tell you a bit about who he is, what he's been doing the last 2 decades in terms of doing pandemic preparedness work, and then what activities he's been engaged in over the last 2 years. So, John, over to you.
Yeah. Well, thank you, Rebecca. I appreciate being included in this. I come to pandemic preparedness and surveillance from an informatics background. My training is in infectious disease epidemiology, with a focus on thinking about how to take emerging technologies and bring them to bear on understanding disease emergence, understanding risk factors involved in disease transmission, and understanding global spread. For 2 decades, we've been trying to work with new data sources to understand what is happening in a community well before often traditional sources in this area of digital epidemiology, which was essentially started with this idea that informal information about a disease event can come well ahead of any formal verification. This was initially through data mining of news and online chat rooms and blogs. We developed a system many years ago called Health Map, which leverages AI and machine learning to track emerging infections, and work closely with another platform that many know called ProMed, and built some of the underlying technology there. And slowly moved into areas of social media mining, into areas of participatory surveillance, all with an eye of thinking about what are the data sources that can provide that early insight, whether that's a Twitter post or a Facebook like, or cancellations of restaurant reservations, or satellite images that give you insights and social disruption. Focused in on some of the big tech companies like Google, Apple, Facebook, and how they control the vast majority of the world's information. And so while they use that information from the point of view of ad targeting, we've always felt there was great opportunities in taking that data for social good, and namely being able to predict epidemics and pandemics. So whether that's search query data or social media analysis, we've shown throughout the years that we could use those technologies to early identify a range of epidemics, from Zika to Ebola to West Nile virus to influenza epidemics. And so when it came time to the COVID pandemic, we were already well on our way with various tools that we already had in play, which of course meant that we had existing infrastructure. Now, not really well-funded infrastructure, but nonetheless, some systems that were running at the time that COVID emerged in late 2019. In fact, the earliest signs of what was happening in Wuhan came out of some of that informal sources. We picked up a Chinese language report from our media mining talking about a mysterious illness in Wuhan that impacted about a dozen people that are connected to the seafood market. That was December 30th, and the first real alert that went to WHO and others. Following day, ProMed, our close collaborators and sort of partners, had a post about a mysterious illness, and that was taking place. And of course, social media went ablaze talking about this concern of a novel coronavirus. It wasn't, the concerns about this were bubbling for the first few weeks of January, but I think, the recognition of how bad things could get wasn't necessarily until really towards the end of the month, where we recognized that this was a virus that had real concerning characteristics, and some of the characteristics that we've always been concerned about from a pandemic, which is a virus that is efficiently transmitted, that has asymptomatic transmission, that has symptoms that very much look like other pathogens, and has some reasonable amount of mortality. So recognizing that this was becoming a much bigger issue, we started, deploying the resources of our team through a whole range of efforts. That first effort is actually now a collaboration that we have together, a project called Global.Health. It initially started as a volunteer network where essentially we were just trying to piece together the initial cases of the pandemic, and through coding of identifying individuals, either through official reports or media reports, we created the first line list representation of cases, initially in China, but also elsewhere. And, it really highlighted the fact there was very little data resource around that was in play at the time, because for many of us, we were flying blind, trying to estimate transmissibility, underestimate attack rates, understand impacts in different demographics. And so to do all those things, you needed better data. And so our team, working with our collaborator, Moritz Kramer and Sam Scarpino, built this initial platform that ultimately was funded by Google and became Global.Health, and is now essentially the largest repository of line-list cases on the globe. And so that, in sort of enumerating some of the things that we've done, that of course was a pretty big achievement, and has built up infrastructure that we think will last not only for this pandemic, but also future pandemics to come. We, of course, were focused on the health map early detection side of things, and we're building out that infrastructure. But I think, the next sort of major contribution came from our work in participatory surveillance and crowdsourcing. We had been running a platform called Flu Near You for many years, which is all about engaging the public in public health and having individuals report symptoms and various behaviors. We were able to redeploy that technology as COVID Near You, and essentially built, the first sort of crowdsourced system for COVID. Now, there are many other groups doing this at the time. Many of them don't exist anymore, but the idea was we just didn't even understand symptomology. We didn't understand health-seeking behavior. We didn't understand the impact in different demographics. And when COVID hit the US, we did not have testing or really any ability to fully understand what was happening on the ground. And so crowdsourcing became a really important weapon in understanding what was happening. And, we were able to work very closely with CDC to provide the sort of on the ground data. Interestingly, that platform grew through collaborations that we developed with SurveyMonkey and others to essentially build a really robust, not only surveillance of COVID, but understanding behaviors. And I think one of the sort of more important papers that we came out with during COVID was an ability to understand mask wearing behavior at a high resolution. We collected hundreds of thousands of data points about people's mask wearing behavior. And probably the most controversial or not controversial thing throughout this pandemic has been whether masks work or not. And we got ourselves involved in that debate. Essentially, we're able to show that mask wearing, once controlling for many other factors, could drive transmission down in the community. And so that was an important paper that was driven by crowdsourced information. Our team also started focusing in a little bit on understanding the origin story of COVID, probably too early, in fact, because while now it's more acceptable to investigate sort of what may have happened in 2019, in the summer of 2020, it was still it's still politicized, but highly charged topic. We decided to look at data that we have for previous research projects, one being satellite imaging of hospital parking lots, and another being search query data out of Baidu. And by looking at sort of these satellite images and search query data, we were able to show that there was some level of activity, both from a symptoms perspective, but also from a healthcare utilization perspective in the fall of 2019. We published that, and initially reaction were quite positive, or at least, helping sort of add to the conversation about what took place. One of the things that really ultimately happened was Donald Trump tweeted about it. We tweeted about a Fox News interpretation of our study. And that is when my life, but also the life of my co-authors became really, really challenging. It unleashed a world of hurt online, a lot of inbounds, a lot of threats to my life, a lot of threats to my coworkers' life. And it was right sort of, I guess, at the height of cancel culture conversation as well. And so there was a lot of challenges to our academic credibility, and a lot of assumptions that the work that we were doing had some bias associated to China. So anyways, that was a pretty dark time because we sort of had to go into hiding for a while, and the university had to get involved, and it was a really challenging moment. And again, it's not like it's so dissimilar to many of my colleagues who sort of went through similar challenges, having been thrown into some debate where the intentions were purely academic, but the conversation was much bigger. And so anyways, that was probably one of the low points of the pandemic, when we sort of got ourselves embroiled in that debate. I would say, probably that to counter that, so from sort of the low point, the high point, I think, in our view, or in my view, is our contribution to the vaccine rollout. Our team for many years had been running a tool called vaccinefinder.org. It was a tool actually that we initially started during the H1N1 pandemic and took over and worked with CDC on. And it's been the sort of federal government sort of sponsored a website from the beginning, for a decade now. And so when it was clear that a COVID vaccine was going to be rolled out, Vaccine Finder became sort of the central point for how Americans were going to be able to figure out where the vaccines were and how to find them in their community. So we took Vaccine Finder, actually did a full rebuild and made it vaccines.gov, and we still run it to this day, and launched it a year ago, or just about a year ago. And obviously a huge amount of visibility on a website that was going to provide vaccines. So a lot of stress in terms of whether this would crash. Obviously, other .gov websites have had challenges in the past, but we had a great rollout. And we've been used by over 100 million people at this point, and it's been highly touted in all sorts of different ways. Partnerships with companies like Google and Apple and Facebook and McDonald's and Uber, Lyft, Tinder, Bumble. So basically any tech company has leveraged the data in all sorts of different ways. So that was a great experience. And to finally to have a US president who is also talking about a project you did, but in a way that didn't cause a huge amount of pain, was a nice sort of 180-degree experience for us. And then that project has led to all sorts of really interesting efforts around not only helping support vaccine rollout, but understanding vaccine deserts, trying to optimize the ways in which the population can access vaccines. Clearly, we spend a lot of time on understanding vaccine confidence, understanding the factors that drive people to make decisions. And there's a combination of vaccine confidence and access that sort of ultimately decides whether people get the vaccine or not. We've spent a lot of time trying to understand sort of the combination of vaccine hesitancy, but also distance. We've been working with the Biden administration to figure out sort of how far people live to get a vaccine, and then also understanding confidence in the various 3 vaccines that are on the market, and understanding sort of how people are making some of the choices they're making. And so working very closely with the CDC on all these different, vaccines.gov, but also the Outbreaks Near Me project, which is all about crowdsourcing, getting sort of attitudes and beliefs around vaccines. We're also trying to do work in testing and try to help optimize access to testing. And that's coming down the pike right now. So yeah, I mean, it's been a hard couple of years. Our team has worked really incredibly hard, as most of our colleagues, and we feel pretty grateful that we've been able to contribute in meaningful ways and have, impact in, a time when, it's, that is mostly very challenging for the vast numbers of Americans out there. So we feel like we've had at least made a dent in the response. And now the question is sort of how we prepare for future. And we're trying to build infrastructure, whether it's on the surveillance front or the vaccine response side, that will support future pandemics. The work that we're doing at vaccines.gov is extended to flu, and it's going to be a rapid response tool to access interventions. It's going to be expanded to vaccines in kids. It's likely going to expand to antivirals, all sorts of ways. The Global.Health project is only growing in the sense that it's really going to be a focus of how we're going to, think about responding to providing data needs in future pandemics. Our tools of health map, outbreaks near me, have reasonable support from various government entities, and it's just now a matter of how all these tools will fit in the interesting landscape of major initiatives that are coming up, whether that's efforts at CDC or WHO or nonprofits like out of Rockefeller Pandemic Prevention Institute. But it's a very hopeful time. It's exciting to see the investments in data infrastructure in ways that we've never even come close to seeing before. And now it's a question that, hopefully we'll see sustained investments in these activities. That means that we won't be starting from scratch in the future. So,
I hope not.
Yeah, no.
Can I ask? I mean, it's kind of impossible to just in these few minutes to truly understand the enormity of the work that you've done over the past 2 decades and the work that you and your team have been engaged with during the pandemic. But in addition to all of that, you've also taken a very active role in science communication. And wonder if you could just talk a little bit about what you've been doing, how you got involved in that, and what that experience has been like.
Yeah, no, I totally sort of forgot to bring in the media side. I, like a lot of colleagues, we've been tapped to do a bunch of science communication. At the beginning of the pandemic, I did a special with ABC News 2020, and from there did a couple more spots. And I think similar to colleagues across different networks, became a regular on ABC programming, whether it's World News or Good Morning America or streaming or whatever, a television show. And I think, I've put a huge amount of effort into that. I think that there has been an information gap, absolutely. And, we know the challenges of interpreting guidelines and understanding, for the general public to understand trajectories of where we're headed with this pandemic and try to create sort of a reasoned approach to how to handle risk at the individual level. And so, that's also a very privileged position to be in, to be in a spot where you can educate, millions of people simultaneously. And so there, while doing our research is super important and it's a priority, the ability to help translate science and bring that more broadly in a time where there's a lot of confusion and misinformation was one that I've been happy to do. So I've been working with ABC for the last couple of years. That's continuing for now. We'll see, at some point, all these epidemiologists on TV will go back into their holes. They're not quite in the holes yet, but they will be at some point. I had the privilege of winning an Emmy for one of the specials that we did. So that was pretty cool. So, it's opportunities to do things that you would never have done before. So, this is apart from having a cameo in the movie Contagion, there's not many chances to interact with media, news or otherwise. So, yes, so that has been a big part of how these couple of years have played out for sure.
Well, John, amazing. And I hope that like the line of "I won an Emmy" goes on to like the next grant proposal somehow gets it, weaved in. I just want to thank you for everything you've done, for everything you are doing. I've personally learned so much and love being able to have the chance to work with you. So
Same here.
just
Goes
thank you
both ways.
for your contributions to ending a pandemic.